So what's next in the in health reform? So this cut is to kind of take through the near-term pieces, because there's a lot of parts in the bill that come into effect over time, stretched out over the next 7 to 10 years. But the first couple of things that'll be most noticeable to consumers are tax credits for small businesses. So businesses with 25 or fewer folks and average wages of less than $50,000 can qualify for a tax credit of up to 35% of their cost of their premiums. Dependent coverage. Parents are allowed to keep their children on their health insurance until age 26 if the child is ineligible for coverage otherwhere. Now, this is an interesting piece. We've heard a lot of chat about this that, and I think Bill's got a 24 or 25-year-old this could apply to. At first blush, a lot of folks read this and said, great, I've got a 25-year-old college student that's buying health insurance currently. I'll roll them back into my family plan through my employer, where I'm kind of, paying. I've already got everybody insured, right? I've got the entire family premium I'm paying for. It doesn't say that you can bring that person back in with no additional cost. It just says you can bring that person back in. So one of the challenges of the speed with which the legislation passed is all these little mandates. The insurance companies are going to have shots on many of these to say, oh, absolutely. And that person's going to cost $6,000 to bring them back in. So there's a lot of little things missing when you put these bills together this fast. The high-risk pools is the next one I'd point out to you on this slide. The law of the land is that within 90 days, the states are supposed to be ready to administer the high-risk pools, which create a product for individuals with pre-existing conditions. Well, I think we're down to 87 days now from the Senate fix. This is pretty quick to expect 50 states to have the high-risk exchanges up and running. And so it'll be very interesting to see what happens when, if the states can't have the high-risk exchanges ready, what are the other domino effects? I mean, this is moving, at light speed, trying to accomplish some of these things in 90 days. Particularly, and I'll tell you in a minute, a significant portion of the states are trying to sue the federal government not to do this at all. So you got to imagine how hard are they actually trying to get their exchanges up. Okay, let's talk about that on the next slide. So health reform, a little bit closer to Texas. So how will health reform affect Texas? There's a study out done by the Health and Human Services Commission that projects the cost to Texas of $20.4 billion over 10 years. That's 2014 to 2013. And this is one of those things where everybody bring your favorite actuary to the calculation and you can get a lot of different numbers. And so I think Jim has some different numbers he can quote to this as well. But these are the numbers typically that you're going to hear Perry and Dewhurst talking about. These are kind of the Texas point of view on these numbers is that it's going to cost us an additional $20 billion over the next 10 years to comply with, to fund the Medicaid requirements. Now, Ray Perryman, who's a noted Texas economist, would tell you there's a multiplier effect on the short run of over 3 times. So you've got to think about the economic benefits of having all those dollars going through the healthcare system, besides the fact that the real point of this is to have healthier kids and healthier working adults. So there's a lot of things in here. It's really kind of hard to measure, as you all know in healthcare, what really is the value of healthcare versus the cost of it. So there are some pieces to it on the upside in terms of benefits. As to challenging the bill, Texas has joined, I think it's called through an amicus brief, the Attorney General of Florida, along with about 13 other states, to sue the U.S. government under the bounds that it's unconstitutional to require individuals to buy health insurance. It's a states' right issue. At Deloitte, we think that this will be resolved relatively quickly. For those of you who are constitutional lawyers in the room, we can have a nice, long, heated debate about whether it should or how it should work out. But there's a lot of track record of the federal government expanding power through the 10th Amendment, and we think this is going to happen in short order. And so the other thing that we're seeing that's affecting companies in Texas that's interesting is you've probably noticed these announcements from AT&T, 3M, Deere, Caterpillar. There are about 300 companies that have hinted they're going to be taking announcements related to a non-cash charge about the loss of deductibility of the subsidies they get on the retirees. And so AT&T is out with $1 billion, clearly formerly a Texas-based company. So we're tracking that list to see who that's affecting here the most. But significant benefits that are going to cease to give them a tax deduction around that. So a little bit of impact on what's going on with some companies that we hear about in Texas all the time. So before I hand it over to Jim, what I would leave you with is this is moving in real time, and we are taking the bill apart in smaller sections and doing additional white papers and studies on them. If we can get you additional information through some of our resources, we'd be happy to do that. We have a Monday memo you can get that gives you an update of what's happened every week. It's pushed to you directly from the website. We have RSS feeds, other things like that. So a lot of white papers and research, looking forward to your questions. I would say this is the law of the land. There's a lot of great stuff in here. In that many pages, there's a lot of really good things. There's a lot of things there we don't still understand, and a lot of things that were written without kind of adequate time for everybody to understand. So we're excited to see it all play out. I think in a month from now, we'll all have a lot better understanding of exactly what we've got on our hands.